Welcome back to Grayson Telehealth. My name is Dr. Victoria Ngozi Ogbuji, the anchor of this program. And if this is your first time of coming across my channel, I am so thrilled that you are here and I welcome you. If you have been following my channel previously and you're here again, I just want to say thank you. And I want to give you a big shout out for your support. So today I'm here basically to answer a question that someone sent and wanted to know about immunotherapy. She said that she has options to choose concerning a condition she has, and she just wants to know what it means, even though her doctors, her care providers did talk to her about it. She wanted me to just throw a little light on it. So have you ever heard about immunotherapy? Or have you ever heard or read about the immune system? How do our body fight infection? That is what it simply means, the immune system. How do the body recognize there is a foreign body, just like you are the security agents, the police, the military, and they are, guarding our boundaries or some security points. How do they know that not everyone that is coming has a good intention? How do they know it's time to strike? How do the body protect itself against the invasion of foreign bodies that are there to attack the body, to destabilize the hemostasis of the body? And that is simply what we are here to talk about today. This is Dr. Victoria Ngozi Ogbuji. And if you have not subscribed to my YouTube channel, please do so as soon as possible, or just right now, click the button. If you have not shared this video, please do it as soon as possible, because you never know who will benefit from it. You never know who this video is just an answer to his or her pressing questions. So listen and make sure you don't miss any part of this discussion. Okay, welcome back. So, what is immunotherapy? Before I go into that, I want us to talk about the immune system. What is the immune system? The body immune system. Everybody, even a child of a day-old child, has immune system, and the oldest person living in this world has immune system. So the immune system, the research says, is a collection of organs, special cells, and substances that help protect our body from infections and other diseases. That means they are a collective of organs, substances, special cells that protect our body from the invasion of harmful or toxic substances, organisms that will make us be sick. Okay? So the immune system, these organs I earlier mentioned, they just travel from the head to toe. They cover the whole of the body. They go through the bloodstream. So what happens when the body, the immune system, is not able to recognize certain cells, certain harmful cells, like in the case of cancer cells? What happens? And that is when there is need for immunotherapy. So what is immunotherapy? Immunotherapy is a treatment, a form of treatment that is used to boost the immune system to fight certain diseases, especially cancer. So what are some ways of getting this immunotherapy working so that the body will be able to do what it's supposed to do, to tackle, to fight against these invasive agents like the cancerous tumors? So when we talk about immunotherapy, what we do is, one, to stimulate the immune system, to make the immune system recognize that it's time to work harder than it naturally works. So when the immune system is stimulated, or is boosted, it helps the natural defense systems, that is your immune system, to work harder, to be smarter, to find and attack those cancer cells. That is one way. Another way is to introduce substances that were artificially formulated, like in the lab. Introduce those substances in form of medications, vaccinations into the body, so that they will help the natural immune system to improve how they function. That way they can find the foreign agents like the cancer cells and attack them. So immunotherapy, the research shows, works better for some cancerous tumors, and for some cancerous tumors it's not that effective. So it is not used for every form of cancer, in a nutshell. When we talk about immunotherapy, what are the limits? What are the clear limits when we can say, oh, we can use this therapy for this, or we cannot use it for this? Or, oh, it's actually working, or it's not working? Or let me rephrase it. When can we actually use immunotherapy? So we can use immunotherapy when the body system is not strong enough to attack certain cancerous cells. And why is it that some cancerous cells respond so well to immunotherapy and some don't respond that well to immunotherapy? Like I said in my previous video, cancerous cells are just normal cells that become disobedient and just start dividing, mutating so fast and become tumors. So mind you, the body already is used to having those cells. They recognize them already as part of them. So if eventually that part of the cells that was normal suddenly becomes abnormal, it can create crisis actually for the immune system to recognize that, oh, actually something is wrong. And that is why most of the time the immune system cannot attack them, because they have been used to having them as part of the system. So that is one of the reasons why the immune system needs help, and we now talk about immunotherapy. So sometimes the immune system do recognize that there is a problem. This part of me is now doing something that is not part of our agreement. And then the immune system tries to attack it, but it's not strong enough to attack it because it has been part of the system. So that is why we need immunotherapy to boost the natural immune system so that it will be able to attack the abnormal cells, like in cancerous cells. Also, remember, when these normal cells start to mutate and become abnormal or cancerous, they produce other substances, other proteins that become resistant to the normal immune system. That way, the immune system is not able to attack them. And that is why we need immunotherapy to help boost the immune system so that it can attack the cancerous or mutated cells. So there are different types of immunotherapy which we cannot discuss in depth in this section, but I will just mention them for the sake of creating the awareness. So there are several types of immunotherapy that are used to treat mainly cancer. Some of them have been studied by great researchers and have been found to be very effective, like the checkpoint inhibitors. These are drugs that basically breaks off the immune system and helps it recognize that it's time to attack the strange cells, the cancerous cells. Those are called checkpoint inhibitors. We have the chimeric antigen receptors. It's like T-cell therapy. It's a form of immunotherapy. In this type of therapy, the T-cells are taken from the individual, assuming, let me use myself, I have a kind of cancerous cells that immunotherapy is the option. So in this chimeric antigen receptor T-cell therapy, these are done by people that are well educated in this field. They'll take the T-cells from my body and mix it with some special viruses that makes T-cells learn how to attack the tumor cells. So after that is done in the lab, it is now introduced back to the body of the patient. That way, it helps the immune system to attack, detect, and attack the cancerous cells and get rid of the cancerous cells. The immunotherapy can also be in form of cytokines. That way, small proteins that carry some messages help to stimulate the immune cells and they attack the cancer cells. We also have the immunomodulators. This group of drugs generally boosts parts of the immune system to treat certain types of cancer. Then you have the cancer vaccines, just like you get vaccinated. So in this immunotherapy option, the vaccine is introduced into the body and it helps to treat the cancer cells. For the oncology specialists, we have the oncology viruses. The research shows that these treatments uses viruses that have been modified in the lab to infect and kill certain tumor cells. So immunotherapy is real. It's effective, but not for all types of cancer cells. So my best advice is make sure before you take any decision about immunotherapy that you are well informed, that you sign the consent based on information, that you're well informed and you give informed consent, knowing that immunotherapy modifies your immune system. And just like every other medication or therapy, it comes with side effects. If you have any comments or any suggestions, please do put it down on the comment section and we will have it discussed. Again, this is Dr. Victoria Ngozi Ogbuji. If you have not subscribed to my YouTube channel, what are you waiting for? If you have not shared this video, what are you waiting for? Again, thank you for viewing and see you in my next video. Thank you.